Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 20 practice questions. With out the way, let's get started.
Question 1. The nurse is assigned to assist with caring for a client who has a chest tube. The nurse notes fluctuations of the fluid level in the water-sealed chamber. Based on this observation, which action would be appropriate? 1. Empty the drainage. 2. Encourage the client to deep breathe. 3. Continue to monitor because this is an expected finding. 4. Encourage the client to hold his or her breath periodically. The correct answer is 3. Continue to monitor because this is an expected finding. Rationale. The presence of fluctuations in the fluid level in the water-sealed chamber indicates a patent drainage system with normal breathing. The water level rises with inspiration and falls with expiration. The apparatus and all connections must remain airtight at all times, and the drainage is never empty because of the risk of disruption in the closed system, which can result in lung collapse. Encouraging the client to deep breathe is unrelated to this observation. The client is not told to hold his or her breath. Question 2. The nurse is assigned to assist a healthcare provider with the removal of a chest tube. The nurse should reinforce instructing the client to do which during this process? 1. Stay very still. 2. Exhale forcefully. 3. Inhale and exhale quickly. 4. Perform Valsalva's maneuver. The correct answer is 4. Perform Valsalva's maneuver. Rationale. When the chest tube is removed, the client is asked to perform Valsalva's maneuver. The tube is quickly withdrawn and an airtight dressing is taped in place. An alternative instruction is to ask the client to take a deep breath and hold the breath while the tube is removed. Question 3. The nurse is preparing to begin a continuous tube feeding on a client with a nasogastric tube. In which position should the nurse place the client for safe administration of the tube feeding? 1. Supine. 2. Supine on the right side. 3. With the head elevated 15 degrees. 4. With the head elevated 45 degrees. The correct answer is 4. With the head elevated 45 degrees. Rationale. When a tube feeding is administered, the client is placed in a high Fowler's position for a bolus feeding and in a semi-Fowler's position 30 to 45 degrees for continuous feeding to allow gravity to help the flow of formula and to prevent reflux and aspiration. Question 4. The nurse is preparing to administer an intermittent tube feeding to a client with a nasogastric tube. The nurse checks the residual and obtains an amount of 200 milliliters. Which action should the nurse take? 1. Hold the feeding. 2. Administer the feeding. 3. Flush the tubing with 30 milliliters of water. 4. Elevate the head of the bed to 90 degrees and administer the feeding. The correct answer is 1. Hold the feeding. Rationale. When 200 milliliters of residual formula are obtained, the feeding is held because this is an indication that the feeding is not being absorbed. If the residual is less than 100 milliliters, the feeding is usually administered. Large volume aspirates indicate delayed gastric emptying and place the client at risk for aspiration. In addition, the nurse should always check the healthcare provider's prescriptions and agency policy regarding residual amounts. Elevating the head of the bed to 90 degrees and flushing the tubing are not appropriate actions. Question 5. The nurse is assisting in planning care for a client with a chest tube. The nurse should suggest to include which interventions and plan? Select all that apply. 1. Pin the tubing to the bed linens. 2. Be sure all connections remain airtight. 3. Be sure all connections are taped and secure. 4. Empty the drainage from the drainage collection chamber daily. 5. Monitor closely for tubing that is kinked or obstructed by the weight of the client. The correct answers are 2. Be sure all connections remain airtight. 3. Be sure all connections are taped and secure. And 5. Monitor closely for tubing that is kinked or obstructed by the weight of the client. Rationale. Chest tube tubing is never pinned to the bed linens because this presents the risk of accidental dislodgement of the tube when the client moves. The chest tube system is not open and empty because a closed system must be maintained. If the system is open, lung collapse can occur. Question 6. The nurse is assigned to care for a client who has a chest tube. The nurse is told to monitor the client for crepitus, subcutaneous emphysema. Which method should be used to monitor the client for crepitus? 1. Asking the client about pain. 2. Checking the respirations hourly. 3. Checking the blood pressure every 2 hours. 4. Palpating for the leakage of air into the subcutaneous tissues. The correct answer is 4. Palpating for the leakage of air into the subcutaneous tissues. Rationale: subcutaneous emphysema is also known as crepitus. It presents as a puffed-up appearance that is caused by the leakage of air into the subcutaneous tissues. It is monitored by palpating, and it feels like bubble wrap when palpated. Although options 1, 2, and 3 may be components of the plan of care for a client with a chest tube, these actions will not identify subcutaneous emphysema. Question 7. The nurse is told that an assigned client will have a fenestrated tracheostomy tube inserted. The nurse should provide the client with which information about this type of tube? 1. Enables the client to speak. 2. Prevents the client from speaking. 3. Is necessary for mechanical ventilation. 4. Prevents air from being inhaled through the tracheostomy opening. The correct answer is 1. Enables the client to speak. Rationale: a fenestrated tube has a small opening in the outer cannula that allows some air to escape to the larynx. This type of tube enables the client to speak. Question 9. The nurse is preparing to care for a dying client, and several family members are at the client's bedside. Which therapeutic techniques should the nurse use when communicating with the family? Select all that apply. 1. Discourage reminiscing. 2. Make the decision for family. 3. Encourage expression of feelings, concerns, and fears. 4. Explain everything that is happening to all family members. 5. Touch and hold the client's or family member's hand, if appropriate. 6. Be honest and let the client and family know that they will not be abandoned by the nurse. The correct answers are 3. Encourage expression of feelings, concerns, and fears. 5. Touch and hold the client's or family member's hand, if appropriate. And 6. Be honest and let the client and family know that they will not be abandoned by the nurse. Rationale: the nurse must determine whether there is a spokesperson for family and how much the client and family want to know. The nurse needs to allow the family and client the opportunity for informed choices and assist with the decision-making process if asked. The nurse should encourage expression of feelings, concerns, and fears and reminiscing. The nurse needs to be honest and let the client and family know that they will not be abandoned. The nurse should touch and hold the client's or family member's hand, if appropriate. Question 10. Upon palpation of the fontanelle of a 3-month-old newborn, the nurse notes that the anterior fontanelle has not closed and is soft and flat. Which action should the nurse take? 1. Increase oral fluids. 2. Document the findings. 3. Notify the HCP. 4. Elevate the head of the bed to 90 degrees. The correct answer is 2. Document the findings. Rationale: the anterior fontanelle is diamond-shaped and located on the top of the head. It should be soft and flat in a normal infant, and it normally closes by 12 to 18 months of age. The posterior fontanelle closes by 2 to 3 months of age. Therefore, because the findings are normal, the nurse should document the findings. Question 11. When caring for a 3-year-old child, the nurse should provide which toy for the child? 1. A puzzle. 2. A wagon. 3. A golf set. 4. A farm set. The correct answer is 2. A wagon. Rationale: toys for the toddler must be strong, safe, and too large to swallow or place in the ear or nose. Toddlers need supervision at all times. Push-pull toys, large balls, large crayon trucks, and dolls are some appropriate toys. A puzzle with large pieces only may be appropriate. A farm set and a golf set may contain items that the child could swallow. Question 12. The nurse is caring for a 5-year-old child who has been placed in traction after a fracture of the femur. Which is the most appropriate activity for this child? 1. Blocks. 2. A puzzle. 3. a music video. 4. Large picture books. The correct answer is 2. A puzzle. Rationale. In the preschooler, play is simple and imaginative and includes activities such as dressing up, paints, crayons, and simple board and card games. Puzzles are also appropriate and aid with fine motor development. Blocks are most appropriate for the toddler. A music video is most appropriate for the adolescent. Large picture books are most appropriate for the infant. Question 13. An older client has been prescribed digoxin. The nurse understands that which age-related change would place the client at risk for digoxin toxicity? 1. Decreased cough efficiency and vital capacity. 2. Decreased salivation and gastrointestinal motility. 3. Decreased muscle strength and loss of bone density. 4. Decreased lean body mass and glomerular filtration rate. The correct answer is 4. Decreased lean body mass and glomerular filtration rate. Rationale. The older client is at risk for medication toxicity because of decreased lean body mass and an age-associated decreased glomerular filtration rate. Although options 1, 2, and 3 identify age-related changes that occur in the older client, they are not specifically associated with this risk. Question 14. Which data indicates to the nurse that a client may be experiencing ineffective coping following the loss of her spouse? 1. Constantly neglects personal grooming. 2. Visits her husband's grave once a month. 3. Visits the senior citizens center once a month. 4. Frequently looks at snapshots of her husband and family. The correct answer is 1. Constantly neglects personal grooming. Rationale. Coping mechanisms are behaviors that are used to decrease stress and anxiety. In response to a death, ineffective coping is manifested by an extreme behavior that in some instances may be harmful to the individual physically, psychologically, or both. Option 1 is indicative of a behavior that identifies an ineffective coping behavior as part of the grieving process. The remaining options identify effective coping behaviors. Question 15. The nurse is preparing to communicate with an older client who is hearing impaired. Which intervention should be implemented initially? 1. Stand in front of client. 2. Exaggerate the lip movements. 3. Obtain a sign language interpreter. 4. Pantomime and write the client notes. The correct answer is 1. Stand in front of client. Rationale. The nurse would ensure that the hearing-impaired client can see the nurse when the nurse is speaking by providing adequate lighting and standing in front of the client. The nurse should enunciate words clearly but not exaggerate lip movements. If the client is profoundly hearing impaired and uses signing, a sign language interpreter should be obtained. If a client cannot understand by reading lips, the nurse would try using gestures, pantomiming, or writing notes. Question 16. Which intervention should be implemented for the older client with presbycusis who has a hearing loss? 1. Speak louder. 2. Speak more slowly. 3. Use low-pitched tones. 4. Use high-pitched tones. The correct answer is 3. Use low-pitched tones. Rationale. Presbycusis refers to the age-related, irreversible, degenerative changes of the inner ear that lead to decreased hearing acuity. As a result of these changes, the older client has a decreased response to high-frequency sounds. Low-pitched tones of voice are more easily heard and interpreted by the older client. Speaking softly or slowly is not helpful. Question 17. When the nurse is collecting data from the older adult, which findings should be considered normal physiological changes? Select all that apply. 1. Increased heart rate. 2. Decline in visual acuity. 3. Decreased respiratory rate. 4. Decline in long-term memory. 5. Increased susceptibility to urinary tract infections. 6. Increased incidence of awakening after sleep onset. The correct answers are 2. Decline in visual acuity. 5. Increased susceptibility to urinary tract infections. And 6. Increased incidence of awakening after sleep onset. Rationale. Anatomical changes to the eye affect the individual's visual ability, which leads to potential problems with activities of daily living. Light adaptation and visual fields are reduced. Respiratory rates are usually unchanged. The heart rate decreases, and the heart valves thicken. Age-related changes that affect the urinary tract increase in older clients' susceptibility to urinary tract infections. Short-term memory may decline with age, but long-term memory is usually maintained. Changes in sleep patterns are consistent. Age-related changes. Older persons experience an increased incidence of awakening after sleep onset. Question 18. The nurse is planning to feed an older client who is at risk for aspiration of food. During the meal, how should the nurse position the client? 1. Upright in a chair. 2. On the left side in bed. 3. On the right side in bed. 4. In a low Fowler's position with the legs elevated. The correct answer is 1. Upright in a chair. Rationale. It is preferable to get clients out of bed and sitting in a chair for meals. This position facilitates chewing and swallowing and prevents the reflux of stomach contents and aspiration. Question 19. The clinic nurse is assisting to perform a focused data collection process on a client who is complaining of symptoms of a cold, a cough, and lung congestion. Which should the nurse include for this type of data collection? Select all that apply. 1. Auscultating lung sounds. 2. Obtaining the client's temperature. 3. Checking the strength of peripheral pulses. 4. Obtaining information about the client's respirations. 5. Performing a musculoskeletal and neurological examination. 6. Asking the client about a family history of any illness or disease. The correct answers are 1. Auscultating lung sounds. 2. Obtaining the client's temperature. And 4. Obtaining information about the client's respirations. Rationale. A focused data collection process focuses on a limited or short-term problem, such as a client's complaint. Because the client is complaining of symptoms of a cold, a cough, and lung congestion, the nurse would focus on the respiratory system and the presence of an infection. A complete data collection includes a complete health history and physical examination and forms a baseline database. Checking the strength of peripheral pulses relates to a vascular assessment, which is not related to this client's complaints. A musculoskeletal and neurological examination also is not related to this client's complaints. However, strength of peripheral pulses and a musculoskeletal and neurological examination would be included in a complete data collection. Likewise, asking the client about a family history of any illness or disease would be included in a complete assessment. Question 20. A client with a diagnosis of asthma is admitted to the hospital with respiratory distress. Which type of adventitious lung sounds should the nurse expect to note documented in the health record when collecting data related to the respiratory system for this client? 1. Stridor. 2. Wheezes. 3. Diminished. 4. Pleural friction rub. The correct answer is 2. Wheezes. Rationale. Asthma is a respiratory disorder characterized by recurring episodes of dyspnea, constriction of the bronchi, and wheezing. Wheezes are described as high-pitched musical sounds heard when air passes through an obstructed or narrowed lumen of a respiratory passageway. Stridor is a harsh sound noted with an upper airway obstruction and often signals a life-threatening emergency. Diminished lung sounds are heard over lung tissue where poor oxygen exchange is occurring. A pleural friction rub is heard in individuals with pleurisy.
You can check out my study guides and reviews. Links will be in the description. Thank you for watching.